According to the New York Times, there have been more measles cases in the United States the first 5 months of 2019 than there were in all of 1994, when the last large outbreak occurred, in part because of the spread of misinformation about vaccines. Their article stated that the CDC said that there have been 971 known cases of measles in the United States so far this year. Measles could easily be prevented and even eradicated if all children and adults get vaccinated. Immunization is an important topic to target because it is essential in preventing certain illnesses such as cervical cancer, diphtheria, hepatitis B, measles, mumps, pertussis, pneumonia, polio, rotavirus diarrhea, rubella, and tetanus in communities around the world. Without vaccines, several diseases that are now eliminated would still be present in our society. Polio, for instance, was eradicated in 1979 from the U.S. through the use of vaccines, and so was smallpox in 1980. There are several reasons people don't get the necessary vaccinations they need. These include people thinking they're unnecessary, being afraid of severe reactions to the vaccines, having religious reasons, and them not having enough money to pay for them. Not being vaccinated not only affects an individual, but it affects the entire community. World Health Organization reveals that an additional 1.5 million deaths could be avoided, however, if global immunization coverage improves. The Centers for Disease Control states that unvaccinated kids are 6.5 times more likely to be hospitalized with pneumonia, according to the Scientific American, 23 times more likely to develop whooping cough, and 9 times more likely to catch chickenpox. This data further emphasizes how much immunizations affect populations. Furthermore, if enough people in a community are vaccinated, it makes it difficult for infectious diseases to spread. This is referred to as herd immunity, because the population being vaccinated contains the disease. Today, about 80% of infants living in the world's 73 poorest countries receive routine immunizations, a measure currently assessed by whether they have been given a full course of a vaccine regime to prevent diphtheria, pertussis, and tetanus. In 2000, only about 60% received such protection. Therefore, it can be stated that progress is being made, but for this rate to become 100%, vaccination is bound to become easier and more widespread. Our solutions to increase the number of vaccinations around the world include informing the public and taking action. We plan on spreading knowledge to the public about the importance of immunization and what effects it produces, in the hope of getting more people on board with vaccinations. In addition, we hope to create pop-up medical facilities in places that suffer from the spread of deadly diseases the most. The purpose of these would be to further educate people and to provide the care needed for the patients that are ill. Patients would also be able to get vaccines at those establishments. Finally, our last proposal is to create edible vaccines that can produce the same effects. We could create a variety of gummies so it can treat an abundance of diseases, impacting the amount of people getting immunized greatly. Combining many different vaccines such as Tdap and MMR have also increased the efficiency of healthcare, but have kept the price less than if these products were used separately. Eating gummies instead of using a needle would not only be more appealing, but it could also be less costly and it could reach more people. By shipping the gummies to places that need them, we will make sure that it is reaching the people that need it most. To limit the costs of these gummies, as well as other pharmaceutical products, passing price regulations provides an effective solution for budget concerns. Implementing these techniques to the vaccine gummies could yield successful outcomes. Through all of the solutions mentioned, it will help the lack of immunizations around the world because it will inform people about the benefits of getting vaccinated and will provide them with places to get help as well as alternative options to the common shot.